Good evening, everybody. I think you all know Dr. John Echterneck, who is providing support to all 802 Smiles hygienists during this school year. Not that he didn't provide support before, he's been a very long time collaborator with our programs. And tonight he's going to present a refresher on infection prevention and control. I want to just like a disclaimer. I have this disclaimer that watching this presentation is scratching the surface, really, of infection prevention and control. And I will be sending everyone the slides from the presentation. So you can click on many links throughout the presentation, and those links are what are going to lead you to the most recent information. This information is current as of now, but things change. So I recommend everybody to click through the links once you receive the presentation, okay? Let me go ahead and share the slides. Let's do it a different way here. Just one. Bear with me. Slides should be coming up. I think it's loading. There we go. Can you all see the initial slide? Is the size good? Can you see well?
Looks good.
Yes.
Okay, awesome. So, Dr. John, I'll let you take it away.
Okay. All right. Everybody can hear me, right? Give me a thumbs up if you can hear me. You can hear me? Okay, good. Like Deborah said, this is we're barely scratching the surface. There's an awful lot to infection control and prevention. What is most important throughout this program? We only have 13 slides, but you'll notice on many of the slides there are links that you can click on. And this is the reason that Deborah is sending everybody a PDF of this program, so you can download it and then you can watch it and you can click on the links, because an awful lot of the information to get into specifics and to get into details really can find at the links. So next. Okay, every school site is different. I've done a number of school visits already, and some of you, I have been with you at your schools, and there isn't one school that is the same as another school. They're all different. I've done on sites where the dental hygienist is just in the nurse's office, and she sees the child, the student, sitting in a chair, just a regular fold-out chair. And I've been to other places where they have a complete dental treatment room, and complete with everything that you can imagine. And I've also, one of our dental hygienists has a extremely complete setup that is 100% mobile, and he can actually take it from school to school to school. So there's all sorts of, depending upon your tier, probably the higher you go up in your tier, probably the more sophisticated your site is. But it doesn't make any difference what your site is about. There still are certain things that you need to do, certain minimums. And I'm going to repeat this a few times as we go through here. Number one, in safety, yes, we have to protect the public. We have to make sure we're following all the rules correctly.
Oh, there he is. There's Dr. John.
Hi, Lisa. How are you?
Hi. Good to see you.
Good to see you too. So your safety is number one, absolutely number one. We have to protect and take care of our students and the children, but you've got to take care of yourself. Next. Okay, so why are we doing this? What are we, what are we protecting ourselves from? For some of you that have taken my some of my other courses over the years, you know that I'm a real stickler about basic science and depth of knowledge. And what we really have to think about are what are the bad bugs that we're really trying to protect ourselves from. It's primarily bacteria and viruses. And if you look at the bacteria, the three big ones are tuberculosis, staphylococcus, and streptococcus. Those are the three main bacteria that we really have to be careful of. And tuberculosis, I know that there's a very, very low risk for TB, but I can think in my professional lifetime, we've gone through two periods when there's been a TB scare, and it's been brought to the forefront. And we healthcare professionals have been alerted to the fact that there is a TB, a high alert for TB. So it's too easy to take a lot of these things for granted. So again, it comes back to making sure that you protect yourself and do your best to follow the minimum guidelines that we're going to talk about tonight. The viruses, hepatitis B and C, we know those two are important. Herpes simplex 1 and 2, herpes zoster, cytomegalovirus, which chickenpox, mononucleosis. Mononucleosis, it's interesting. I was thinking about that today. Back when I was young in high school, mononucleosis was a pretty big deal. People would get mono a lot, and I haven't heard it even being talked about for a few decades. But it's a classic symptom of mononucleosis is, of course, typical flu symptoms. And also, if you look on the soft palate of the patient, you will see usually small black dots or dark dots all over the soft palate as you're going down the throat. Other viruses, of course, HIV virus. Some of you are too young to have been around, but back in the late 70s, early 80s, when we had the HIV epidemic and how that really that exploded infection control and put it right in the forefront. I come from a time in dentistry when I was in dental school, and for the first 5 years I practiced dentistry, I didn't even wear gloves. We didn't wear gloves. We didn't wear masks. We had no safety precaution whatsoever. And then HIV came along, and that changed everything. And I think it's interesting when I see how COVID has seemed to have changed an awful lot. The changes that occurred back in the late 70s, early 80s with HIV were far more drastic and a much bigger paradigm shift, because we started doing things during the HIV epidemic, and so many of those standards, and I can tell you folks, we in dentistry we still do it better than anybody else, hands down. And if you've ever been to your doctor's office for a checkup, just see how they do things or how they don't do things and compare it to the way we do things. So the changes that we had to make for COVID, I mean, it was really hardly a hiccup. What we had to do was really more just explaining things to the patient more than anything else. So, Deborah, next. I can't say more how profoundly important getting vaccinated is. I don't care if it's for COVID, if it's for measles, mumps, and chickenpox. I don't care if it's for shingles. I am a very pro-vaccination person. This is modern medicine, people, and it's really a tragedy today that we have in culturally and politically what is happening to the concept of vaccinations. And all we have to do is right now, today and yesterday and tomorrow, all we have to do is look at what's happening in Florida. And that is a tragic situation down there with the measles outbreak. But please get vaccinated. for everything and anything that you possibly can. And keep your vaccinations for COVID up to date. Next, Deborah. Post-pandemic infection control for school dental health programs. Like I said earlier, I don't think there's really a whole lot that's changed from what we were doing before. Certainly a few things have changed, but you want to make sure that even if you're operating in tier 2 or tier 3, there's certain minimum things that you need to do, and you want to make sure that especially you are you have adequate PPE for yourself, and that you are making sure that everything in your school nurses area and in the schools that you're operating in, that they're up to speed on the post-pandemic protocols for COVID. I know it can be hard. Sometimes you're in an area where I did a school program during COVID. I volunteered at Alice Peck Day Hospital, and I did 5 different schools. I went around to 5 different schools, and it certainly gave me a taste of what you all have to do and what you have to go through. Some schools were great, and other schools I was stuck in a little closet. So you really have to be pretty resilient, and you really have to be able to adapt to the clinic space that you're in. But do your best. And of course, that bottom box right there, your PPE is absolutely key for infection prevention and control. It is your #1 safety barrier. And you really, it's too easy sometimes to take a mask off or to lift the mask up. Put the mask on, leave it on. It's really important. Next. PPE sequencing. Again, what Deborah mentioned earlier and what I mentioned in the beginning, when you'll get a PDF for this program, and you'll be able to click on the links, and down there at the bottom there's a in blue you'll see it says PPE sequencing infographics. That's a real nice little a bunch of drawings and cartoons and showing you step by step how you can follow a typical sequence for using PPE. Again, it might be different from school to school. I know I was in some schools where we did not have a sink, so we had to use waterless hand cleaners. So you just really have to adapt. One thing I did notice when I did all my site visits, the site visits I've done so far, when I was in a school where the hygienist was doing at least doing tier 4 and some tier 3, everybody wore a gown. I really think putting on a gown is a smart thing to do. It's easy to put one on in the beginning of the day and then you can take it off. It really, really helps protect. It isn't so much that it's an additional barrier to protect you, but it helps to keep the clothes that you have that you're wearing underneath, even if they're scrubs, it helps keep them clean. So if you have a chance to use gowns, please use gowns, and face shields also. If you have the opportunity to use a face shield, please use a face shield. An awful lot of what we do, even just doing a toothbrush prophy, there's a tremendous amount of aerosol that comes out of the mouth from just using a toothbrush when you're doing a toothbrush prophy. So really protect yourself as best as you can. Next, Deborah. Enhanced infection prevention control for post-COVID world. This again just kind of takes you step by step for the things that I think are really important. We have a spelling error in the masking there. It says recommendation: wear a well-fitted surgical mask or a respirator such as an N95 mask. I would strongly recommend that everybody try to use N95 masks. I use N95 masks when I go out into public in certain areas. They're really not expensive. They certainly are a much better barrier than just a surgical mask. So if you get a chance, try to use N95 masks. And again, I'm going to beat this drum really hard. The first recommendation there on the left, make sure that you're vaccinated. Please protect yourself and take care of yourself. Make sure you screen all your patients. I'm guessing that an awful lot of what I'm going over tonight, most of you all do. In fact, you're probably yawning and ready to fall asleep because all of this is second nature to you. Because my guess is you're probably better at it than I am. You know, I come from private practice. I was a private practicing dentist. And for those of you that have worked in private practice, you know that the dentist doesn't do anything. I never did any infection control. I never cleaned up a treatment room. I never had to run an autoclave. I have no idea how to do any of those things. So the area that I'm covering tonight, please know that if any of you have anything that you might want to add to, and Deborah, that certainly goes for you too. If any of you have anything that you might want to add to my little presentation tonight, please speak up. Especially because, as I mentioned earlier, you really are, you know, each school site is completely different from other school sites. So as far as screening goes, actually, I think we got a couple of slides on that, so we can, we'll wait for screening and go to the next couple of slides. So Deb, why don't you go to the next slide? Okay. Again, talking about links and places that you can click into on this particular slide, that first bullet there, the 802 Smiles website, you can find most of the links that you need for all of this information you can find at the website, at the 802 Smiles. If you can't, you maybe won't find every link, but you should be able to find, you'll find a link for OSAP. OSAP is Organization for Safety and Aseptic and Asepsis and Prevention. They have an awful lot of really good information for dental infection and prevention control. That one there, Infection Prevention Control Guide for School Sealants, that one right there is, it fits us perfectly because that's pretty much what we do. HEPA filters, air filters, HEPA filters. I know that when I was doing the programs, the schools that I worked in, not all of the schools that I provided care in had air filters, HEPA filters. If you have one in the building, I would certainly ask the nurse if they have one available, if you're in a room that doesn't have one. And of course, the higher the flow rate through the filter, the more air is going to filter, obviously. I know that when I did the school programs, we actually took one with us when we went on site. It was a small one, and if we got to a site and they actually had another one, we would have two of them running in a room we would be in doing our work. They might seem superfluous, but they really are pretty effective in what they do in filtering the air. Next, Deborah. Okay, just to summarize some things about just some logistical things, tactical things you can do. That first box there in the upper left. This is what we did, and this worked really well for us as a system on how to do your infection control on site. I had two large black plastic bags. I would put one bag on the upper half of the chair. I'd see the first child. I dismissed the child. When I was done, I would wipe down the plastic bag. I would take that plastic bag off. I would hang it over to dry. I would put a new plastic bag on, see the second child. After I was done with the second child, I would wipe off that bag. I would hang it up to dry, and then I would pick up the first bag and put it back on. So I was just alternating the bags, the coverings for the chairs that I was using. If you're in an area that has a full dental setup, you won't have to do that. But I was using a recliner, a poolside chaise lounge recliner as my dental chair. So that was kind of hard to keep clean. So I just used 30-gallon plastic bags. It worked pretty well. Make sure you check, it says the middle box here, screen patients for COVID-19. You know, if you have a child come into your space and they are sick, obviously sick, it's not likely that the nurse is going to let them get that far. But if the child is obviously sick, you know, you might want to inquire a little bit about what might be wrong with the child. And by all means, again, I come back to your safety is number one. And if you feel that you really don't want to have contact with that child on that day because they appear to be pretty sick, then by all means, it's your choice, it's your call, and you can dismiss the patient without seeing them. You have to protect yourself. My guess is that most of your school nurses are doing a really good job of screening the children that are coming in before they get to you, but sometimes things happen and you just want to protect yourself. Always want to check with the school nurse if you have a child like this and see if they can give you any background or any history on that. If you're, you know, I can remember when I was working and if it was quote unquote flu season, I would go to work in the morning, I would put a mask on and I would stay masked all day long, no matter where I was in the office, no matter who I was talking to. If I was in the staff room talking to staff members, if I was in the lab, I kept my mask on. I changed it occasionally, of course, but the point is I stayed masked all day long. If you are in an environment where there might be, you know, the kids, you know, the flu is going around or whatever might be happening, you know, keep yourself protected. Put the mask on and leave it on and wear it all day long. You have nothing to lose and everything to gain. Follow all the normal CDC guidelines for infection control, plus personal protection covers at all times, but don't hesitate to even maybe do more if you think you need to protect yourself. Next, Deborah. Rescheduling after COVID-19. Now, one thing that we have here that has already changed, and Deborah and I were talking about this before we started tonight. If you look at the top box, the blue box, second paragraph, it says, for most people who tested positive, the recommendation is to stay isolated for at least 5 days. Now, apparently they just changed that. Deborah, could you just, I forget everything that you went over that before we started.
Sure, yeah. No, and I recommend clicking on the link because the CDC is constantly updating the information as things change. But what I did see, the change I did see, Dr. John, if I remember correctly, is for people who were, if you're exposed to someone who has COVID, then the guidance now is for you to wear a mask for 5 days if you were exposed, and then you can test on the 5th day post-exposure. If you test negative, you should wait 48 hours, get tested again, and then you can go out in public then without a mask. In the past, they were saying wear a mask for 10 days. So it's constantly changing. Today I checked, that's what it's saying for exposure. I believe for cases where you, like where the patient tested positive, the 10 days still hold. So they shouldn't be seeing you within those 10 days after they started having symptoms, for sure. And then even if 10 days have passed, if they still have a fever, they still shouldn't be scheduled. You should wait until at least 24 hours without fever, with no medication. So that's the current guidelines. The 10 days is really a minimum after testing positive. I would certainly, if I were in a school setting seeing children, I would probably give it 2 weeks just to be safe, like 10 days, so just wait another few days. So just make sure, I would suggest maybe every week click on that link and check. There's other links throughout that are also CDC links. There's one that shows community levels. Now they're guiding risk based on hospitalizations, number of hospitalizations per 100,000 inhabitants per county. I recommend checking that weekly as well because the situation is very dynamic. Today I saw Vermont is low. I think most of Vermont is very low now. But just a week ago, some counties were at the moderate level. So that will guide you, like help you know what kind of risk you're facing, and will tell you how cautious you still need to be. So yeah, that's my recommendation. Just check the link often. Things change.
Good. Thank you, Deborah. That's very important information. Yeah, again, what Deborah said throughout the whole program, you're going to get a PDF, and there are all sorts of links in here. Please go back over it and flip on the links to get a little bit more detail than what I'm offering you here tonight. Particularly that one right at the bottom of the screen there. Click here for current CDC guidance. You'll get everything up to date right there for sure. Next, Deborah. Working environment. Okay. Whenever possible, try to use some kind of surface barriers. That's the best way to keep an area clean or to clean an area up, is to just have a barrier that you can remove or discard. You should still wipe your areas down, even if you're using a barrier. But that's one of the best ways to do it. And again, whatever you're using to wipe down with, you can't use the wipes that you buy at the grocery store. You really have to use an EPA registered disinfectant for sure. Not hard to get. You should have some. If you need some, Deborah, where can they get some if they don't have any?
Yeah, we provide Cavi wipes, and
Okay.
those are approved. Yeah. So and by clicking on that EPA list, you can see, many of you probably know this already, but you can check the updated list of which products are currently approved. If you're buying it at a dental supplier, most likely they're selling something that's been approved for healthcare use.
You know, another thing about the wiping down and cleaning an area, disinfecting an area, and this was something that I was pretty adamant about in my office. A lot of people use spray bottles. I really do not. If you have a bottle with an adjustable tip on it, please don't use it in a spray aerosol. Have it set on a jet stream, because a lot of these disinfectants that we use are classified as pesticides, and chronic exposure to these disinfectants and pesticides are not healthy for us. So I used to have a battle with my staff because they would put it on spray, and I'd walk into a room and the room would be full of an aerosol mist of this disinfectant. And I'm thinking, you're breathing this in. This can't be healthy for you. So try to make sure that you protect yourself from these disinfectants. And I would strongly recommend that you would wear gloves when you're handling any wipes or wiping down a barrier or an area with any of these disinfectants. Again, what I said in the very beginning, I've said it, more than a few times. Please protect yourself in the work area. Next, Deborah. Discarding disposables. As long as there isn't blood on it, you can just throw it in the trash. There's nothing wrong with that. And if you think about it, think of all the things that we do every day at home and the American public does at home, and the things that we throw into the trash, and we just treat it as regular trash. It certainly is perfectly okay to take a wet cotton roll out of someone's mouth and throw it in a trash can. It isn't any different from almost anything else that we think are getting disposed of all over America. I mean, just think about the number of diapers that are just thrown into the trash can, and they could be contaminated with things far more worse than even possibly the blood, a little bit of blood on a gauze pad that comes out of a patient's mouth. So, but if you do have anything that's blood contaminated, you do need a biohazard container. I would ask the school nurse. I'm sure that they have one. I know all the schools that I've been in, they all have biohazard containers. And again, I think a lot of this stuff, most of you already know. Talking about protocols of this nature when you're in a school, it's best to follow the routine that the nurse has set in place. More than likely, it's going to be an appropriate routine and an appropriate protocol that they're following. It's very unlikely that it's going to be something that would not be correct. I think our school nurses are such an important part of our program. I praise them all the time. They are so, and you all know better than I do how important they are and how helpful they are. So do everything you can to mesh in with their routines in their offices. Next. Again, for maybe not the last time, but certainly almost the last time, assess your own personal risk and take care of yourself. Make sure you follow all of the precautions and protect yourself in the work environment. And again, you got a blue click right there. You can a link you can click on to look up. This page is full of little clicks to zoom in on, but to link on to. But please make sure that you protect yourself. Stay up to date on all this information, as Deborah just said a few moments ago. And you can click on that link that will give you updated CDC information. And specifically for what we have the Vermont guidance for pre-K to 12 schools and the CDC public health guidance for schools. That's those two things. With all the links that we have available on this program, you should be all set. And that's all I got, folks. Anybody have any questions or with any additional information? I certainly would think that an awful lot of you, with the experience that you've had in the workplace as 802 Smiles dental hygienist, you probably have some interesting information or some good stories to share. So please feel free. I can't imagine that I covered everything or I know enough. Yes, Catherine.
Mm-hmm.
I wanted to say that I use just disposable, I would say they're food grade gloves, plastic gloves to do my wipe down, just so that I can conserve the regular latex or non-latex, but gloves that I use in patients' mouths. And they were really inexpensive. They're really the kind that, well, you see people in cafeterias using. And I find that that protects my hands from the cavicide. So that's my tip.
Good idea.
Makes sense.
Good
Yeah.
idea.
Yeah, great. Yes, that is a good idea. Please feel free to share any tips and anything like that, or any comments you have, any questions, any difficulties you're finding. You prefer to write it down in the chat, that's fine as well.
I have to tell you, some of you I've already been around to visit, and I'm hoping I get around to see the ones here tonight that I haven't been to visit on site. But I have to tell you, every time I go somewhere, I learn. I think it's more of a learning experience for me. I hate to say this, but I'm supposed to go there and help you guys, but it's probably more a learning experience for me than anything else. I think it is amazing to see everything that you all do and the conditions under which some of you work and how well you accomplish what you do. I really don't think I have as good a handle on this infection control thing probably as a lot of you do. So, you know, if you have anything to add, please speak up. Anybody? Nobody. Okay.
Give people a few minutes. Last chance. Then again, I'll be sending this to all of you as a PDF. And the recording will be uploaded to YouTube by our communications folks. And then once that YouTube link is available, I'm going to link it to it will be available on the 802 Smiles website, so you can refer to it again.
Are any of you using autoclaves? Using instruments that need to be autoclaved? Anybody? I'm sure you've all had experience using autoclaves and autoclaving regular instruments. Make sure that you protect yourself from puncture. That's really important. Really important.
I feel like most programs are doing so much with minimal equipment and minimal instruments, and really this really streamlines the need for sterilization, and also that's very innovative, I think, the way we're doing things in Vermont. But like Dr. John said, the main thing is for you to stay safe, and you can't help others if you're not healthy. So
Absolutely.
yeah.
I think also setting standards too. You know, when you go into a school, and I think, you know, the nurses are going to be looking at you, the administrators are going to be looking at you, and you know, the standards and the example that you all set are really important, for sure.
Any more ideas? Things that are working well for you? Or in the space where you're working, any tips for anyone? Hey, I think maybe we can wrap it up then.
Okay, just if I could just say one thing.
Sure, of course.
This is number 2 of 3 training webinars, training modules we're going to be presenting, and the next one we're going to be doing is going to be on caries control. Pretty similar to the sealant one, but it gets into a little bit more of the science. So I'm looking forward to seeing you all at that next one also, and we will let you know when we have that ready to go. And for those of you that if I haven't yet visited you at the schools, on-site visits, I tell you, I love doing it. I have so much fun. I learned so much. So I'd really like to get out and to visit the ones here tonight that I haven't yet visited. So I'm looking at all the names, so I'm going to make sure that I send you all an email. I'm going to nail you down for a visit for sure. Yeah,
let's take advantage of Dr. John before we let him retire.
At some point, I guess, yeah.
Yeah. Thank you all so much for joining us tonight. And Dr. John, thank you so much for the presentation. I'll be in touch with you all tomorrow. I'll be sending out this PDF so you can click away and go a little deeper into any topics that you feel like you'd like to read more about. And you know where to find us if you have any questions, and get in touch with Dr. John to schedule that site visit, please. Thank you all, and have a good night.
Everybody. See ya.
Bye.
Bye-bye.
Bye.
Bye.